So pivoting onto your journey into your bachelor's degree. So you got your bachelor's of science in biology pre-medical at the University of Scranton. What was the thought process?
Yeah, from a very early age, Mari, I wanted to become a physician. I was going to medical school, and there was nothing going to stop me. And I was just a trauma junkie. I loved emergency medicine from a real early age, and probably growing up with the show ER fueled that fire, right? I wanted to be in that emergency room and help save lives. And then I got exposure to, a trauma center and an academic medical center and a burn unit. And I just fell in love with burns and that systemic disease process that a burn starts off in the human body. And so that was the goal. I was going to go to medical school, and uh, for whatever reason, life has, you make plans and something else gets in the way, right? Um, that didn't work out. And I found my graduate path to getting a master's in health administration. As I was finishing up my bio degree, I also had a minor in healthcare administration. And I took the minor originally to learn as much as I could about the American healthcare system. I said, I'm going to learn laws, I'm going to learn management, I'm going to learn why our health system is so messed up, and I'm going to try to find a way to fix that. And I was a couple credits away from the dual major, essentially, after the minor. And the program director of the grad MHA program pulled me aside one day and he said, you know, you can still go to medical school, but give me 2 years. Come be my graduate assistant, come get your master's in healthcare administration, and you'll be able to take the MCATs and apply to medical school and continue on your journey. But I really think you've got a knack for this. I want to, feel it out, and so come study with me. And so I did. I took him up on the offer, and I became a full-time graduate assistant, which was great because I got a graduate degree for they paid me, and so it all worked out, right? Then, as I was ending my 2-year master's degree, I was just obsessed with Obamacare and the ACA and everything that was happening around healthcare reform. And in my mind, in my young, naive mind, the VA healthcare system was America's social answer to socialized medicine, right? It was our universal healthcare program. And the VA is an amazing place. And I loved every one of the 10 years that I was there. But gosh, how wrong was I to think that that was going to solve our healthcare problems? So I was attracted to a fellowship in the VA health system. And I applied to that fellowship and I got rejected. And so then I had to figure something else out. So I went back home to my home hospital, which was Pocono Medical Center, and applied for an administrative residency. I was born at Pocono Medical Center. I grew up as a volunteer at Pocono Medical Center, worked in the emergency room. I was a hospital admissions rep, same-day surgical admissions rep. I knew that hospital like the back of my hand. And fortunately enough, they granted me an administrative residency just based on the network that I was able to build there, right? 3 months into that residency, got a call from the VA, and they said, "Hey, we'd like to offer you that fellowship again. Could you start next month?" And I was very excited, but very conflicted. And I had just signed and made a commitment personally to folks that I had known for years at Pocono, and I wasn't going to back out of that commitment. And so I called the VA back and I said, I've entered a 6-month administrative residency program, and I intend to finish that out. Is there any way that I could start my fellowship January 1st, the beginning of the year? I was fully prepared for them to say, no, we're going to move on to the next candidate. But fortunately enough for me, they said, sure, we'll hold until the beginning of the year and you can start after graduation. So it all worked out.
Well, that's awesome, and thank you for walking us through that.